Hi, my name is Mercy. I'm a student physical therapist working with Dr. Clausen. I'm at Rocky Mountain University. How are you today, Bonnie?
Great.
Good. So I know you're coming in today for some low back pain kind of in your L5 region off to the right side. Happened about 2 years ago, so pretty chronic. I would say this would be a chronic phase of tissue rehab or of tissue healing. So we know that we've had these symptoms for quite a while. We think ultrasound would be beneficial for you because it can help with increased blood flow, decreased muscle spasms, helps with pain modulation, and helps with collagen fibers and joint capsule. Some reasons why we wouldn't do ultrasound would be if you have decreased areas of sensation, malignancy in the area, possible pregnancy, or recent menstruation. Since we're going to focus on the low back area, I would just check for that. Benefits of ultrasound that we would do today can help with decreased pain, increased joint mobility, and decreased joint stiffness, which there could be a combination of reasons why you're having this pain for so long. So we kind of just want to make sure that your pain is reduced and we're increasing the joint mobility of your area, of your low back area. So with that brief description, are you all right if we do some ultrasound today?
Yes.
Okay, perfect. So what I'm going to do is, you shouldn't feel anything. It should be maybe a warm sensation, but there should be no pain. And if you feel any excess warmth or pain, just let me know and we'll stop it. So what I'm going to do is I'm going to put this gel on, and then we're going to use this ultrasound unit to give you some ultrasound on your low back area. Are you all right lying down on your stomach so I can assess your back? Okay. And I can put a pillow under your legs if that's comfortable for you. All right, how's that feel?
Good.
Good? All right, and are you okay if I raise your shirt up?
Mm-hmm.
Perfect. Okay, and then I'm also going to place this towel on your pants just so I don't get the gel on you. That's okay?
Yep.
All right, so first, before I do that, I'm going to just palpate your lower hips and find your PSIS so that I know where to find your L5. Is that all right?
Yeah, that's fine.
Okay. Okay. How's that feel?
A little tender, but...
Yeah. Okay, so I'm going to roll your pants down just a little bit.
That's fine.
Okay. PSIS is typically in line with S2, so then we can palpate S1 and L5, which is typically the lowest part of the lumbar spine as well. So with L5 being right here, I'm going to treat the soft tissue to the right of L5, so right there. Can you feel my hand right here on your back?
Yes.
And kind of this whole general area?
Yep.
Okay, good. So I know that there's no decreased sensation there. And I should have asked earlier, but is there any chance that you're pregnant right now?
No.
Okay. And have you menstruated or have a menstruation right now within the last 5 days?
Nope.
Okay, perfect. So I just like to assess that and check just so there's no contraindications for ultrasound. And did you feel that gel go on? It's probably a little cold.
Yeah, it was a little cold.
Okay, good. So we know temperature sensation is okay. We're going to turn the machine on and go to sound for ultrasound. We're going to do 1 megahertz because we want some deep penetration of the ultrasound unit to work into the paraspinal muscles. We're going to do continuous because we're going to do thermal ultrasound at 100% duty cycle. And then intensity we're going to increase to 1.5, but it could be anywhere between 1.5 and 2. And then time, with this being her first visit, we could do 10 minutes, but I'm going to just start at 10, we could do 10 minutes, but we're going to just do 5 for today, and we'll just assess how the patient is doing. And I'm going to put the ultrasound head, spread the gel a little bit, and then with the head on the patient's body, then we'll start the machine. Okay, how's that feel?
Feels fine.
Good. All right, so we want to make sure that the ultrasound head is firmly placed on the patient's skin so that there is no air that is let into the treatment zone, which could affect treatment and damage the crystal. But we want to maintain about 2 to 3 times the ERA the effective radiating area of the ultrasound unit so that we are able to target the tissues. Still feeling okay, Bonnie?
Yeah, feels good.
Good. All right, so we would just keep in this area, working around the paraspinals and L5 just to make sure that we get enough ultrasound delivered to tissues that might be in pain, help increase blood flow, decrease joint tensile, or increase the elasticity of the joint, so improving mobility. And we would do that for about 5 minutes for this first treatment, and can go up to 10 minutes from there. But for today, we're just going to end it there. I'm going to keep the unit on the patient while I hit stop. Okay. All right, and I'm just going to wipe the gel off. All right, and I didn't see any redness or rashes to begin with, and I don't see any now, so we know that there was no tissue damage or irritation, so I would say that's an effective treatment. And then we can go forward with more ultrasound, increasing the time if needed, but for pain control, thermal ultrasound is the best. So thank you for being my patient.
Thanks.